Cloud.
There you go.
Hey, Lou.
Hey there, Lou. If I don't get to you first, please mute
House will be in
yourself.
order. Members will be in their chairs. We shall be led in prayer today by Lee Crawford, the pastor of the Cathedral of Praise Christian Center in Springfield.
I think that's Rep Ford.
From starting their laptops.
Could we mute him?
And rise for the
Figure out where
invocation.
that's coming from. All right, mics are muted.
Okay.
We're officially
Okay, so let's get started, everybody. Oh, sorry. That's someone else. Thank you. Welcome, everybody. We've got 43 people in the room. Some other folks may be coming in, but we've shortened our meetings basically to an hour now, so we like to keep it pretty much on time. As Al Orsello likes to say, start on time, end a little early. So welcome, everybody. As you can tell, we're entering that exciting time of year where in the city that, we're giving little rays of hope that obscure the hidden dangers of upcoming ice, snow, and heading out in the wrong clothes. And this period lasts until about the middle of June, so brace yourself, okay, everybody? I'm going to put up the agenda just one more time so everybody sees what we're doing today. I've got a few minutes from me. I'm not sure if Rep Ford will be joining us, but we'll get a few words from him if he can. Rafael Rivera from Super is going to give us some overview, I think specifically around harm reduction. We have a CDPH update. They've been doing a lot of great work with the task force. I'll get a little update from the direct intervention outreach folks. And then we have some member updates from way back in and Transforming Lives from Catholic Charities, which is a doulas program, and anybody else can add if we do have time. We don't have a next meeting scheduled. Can we do this in person? I don't know. Hopefully we'll be in that situation. All righty. Oh, are you seeing this?
I'm not seeing your screen just yet.
Oh, see, I just opened, I didn't share up anyway. Sorry about that. Before I go any further, I do want to mention one of our, I don't know if he's on today, but Brother Andre Hinton. I received information today that he received the Dream Makers 365 Freedom Fires Award yesterday. Andre is a man of the community, and he's just about every meeting that you want. He's there. He runs some meetings, he participates in meetings, and I'm going to plop information about that if you'd like to see the piece that he was a part of. It's on online, so I'm going to put that in there with all the information. Whoops, that's not the one. Just when you think you really know what you're doing.
You got it.
Post that. Passcode is there. His information starts about 15 minutes into it. And yesterday, I want to mention, yesterday I was at a really excellent event. It was an online event called Harm Reduction and Focused Care in Uncertain Times. It was held by the Illinois Co-occurring Center for Excellence of the Midwest Harm Reduction Institute and the Heartland Center for Systems Change. Tom Kinley was the host of it, and our partners Peter Moynichin and Melissa Hernandez were amongst the speakers, and it was very moving, very informative, about harm reduction and the impact. And really the agenda today is going to really be featuring harm reduction, not because this is a special.
Yeah, I'll talk to you about it later, but she's
Please mute. Thank you.
She's gonna.
We're going to be featuring harm reduction, but it's, again, not for any special purpose. I think because in Chicago and indeed the state of Illinois, we are realists and understand that our way out of this crisis is through hewing close to harm reduction principles and practice to one degree or another, and that's what we do. I wanted to share an image that I saw yesterday. that kind of sums up, wasn't at the meeting, but it sums up a lot of gives you a kind of a broad definition. What are some of the core values of harm reduction? First and foremost, it's meeting people where they're at. It's really allowing the person that we're working with to direct their care and have ownership of their own care. It's done with compassion and dignity. It centers the experience and voices of people who use drugs when creating policies and practices. In the vernacular, nothing about us without us, and also it minimizes risks associated with drug use. We've seen a lot of hype right now based on the $30 million that was released from the federal government and the focus on harm reduction now coming to the fore. And it's been, the message has been polluted by a lot of hype that doesn't really respond to it. I'm not even going to mention it because I don't want it to continue to roll out there, but we have to be very careful about the messages that are coming back in response to our good work. And we're not going to retreat from what we're doing here on the West Side. The harm reduction practices that we've been doing have making a dent. There's almost 1,900 less EMS calls for overdoses in 2021 than there were in 2020. And so we know that something's working, and this task force is certainly working. So thank you all for all that and all the work you all do. So moving along into the agenda, I want to welcome, I don't know if Rep. Ford is online.
Not that I am seeing, unless he's one of the random numbers in the room, but I'm not seeing his name. Yeah.
And I apologize for some of the new attendees today. We just don't have time with this amount of people to do the introductions. Hey, Brother Andre, nice to see you. Congratulations on your award. You're certainly a deserving person, probably one of the more deserving people I know. So I appreciate it. Thanks for all your hard work. So let's move over to Rafael Rivera from Super. Welcome, Rafael.
Thank you, Lee. Hello, everyone. I'm Rafael Rivera. I'm the Deputy Director of the Bureau of Prevention Services within the Department of Human Services, Division of Substance Use Prevention and Recovery. So that takes half the meeting, just to give my introduction. What I wanted to touch on isn't necessarily an update from Super. We stay focused on increasing access to medication-assisted recovery and also saving lives. We are still staying very clearly focused on that. But Lee said he didn't want to mention something, but that's basically what I wanted to talk about. So I am part of the SAMHSA steering committee. And so this whole harm reduction setting that we're finding ourselves in really started when OEND, actually the White House. Here, I'm going to share my screen. Let me see if I can do this real quick. Okay. Okay. Well, you know what? It's not going to work because it wants me to do something here. No. Well, let's forget about that. So basically what I was going to share was more of a timeline on how quickly this has become an issue. Back in December 8th, 2021, there was a briefing press release from the White House. And basically that headline read that the White House releases model law to help states ensure access to safe, effective, and cost-saving syringe service programs. And so that's when harm reduction at the federal level, beyond what the CDC had been funding up to that point, started to take hold. And there was another headline that I was going to share with you, which is how SAMHSA came to the harm reduction space. And so they put out a grant, and it was the harm reduction grant. And we at both Super and the Department of Public Health really encouraged organizations to apply. We ourselves weren't going to apply, so we were encouraging as many organizations in the state of Illinois to apply. And within that, what we found in the actual NOFO from SAMHSA under the data collection, performance measurement, and project performance assessment is that when requiring data that was going to be submitted for this project, for those that received the award, there was a list and quantity of harm reduction materials purchased with grant funds, including but not limited to, and one of them is safe smoking kits and supplies. So there was definitely a support for the broad range of harm reduction activities that could happen at the community level. And then we started hearing some pushback. First, we heard some pushback, I think came out of Fox News, and some terms that were used, especially crack pipe, which is one of those dog whistle terms that starts implying that African-American populations are the ones that would benefit the most from this if we're handing out crack pipes. It refers back to the 80s and the crack epidemic. And so the way that it was termed was very disappointing, which that's what Lee basically said. He didn't want to talk about it because it was just, it was ridiculous. And then HHS came out with a statement that they were not funding anything that had to do with crack pipes. And now, 4 days ago, there was a bill introduced by Manchin and Rubio, basically to prohibit federal purchasing of crack pipes and needles for drug use, which means syringe exchange programs or syringe service programs would be impacted if they couldn't show the need because of Hep C outbreaks. So anyway, the reason I decided that we needed to really talk about this, and was because I feel like this is gaining steam so quickly. The backlash against a simple harm reduction process has gained steam so quickly for something that's been, I mean, harm reduction has been around for more than 30 years. And I feel like part of that was driven by SAMHSA's attempt to create a platform for harm reduction, for funding harm reduction services. So we need to really support. Thank you, Wilnice. I mean, Dr. Jasmine. There actually is a very nicely balanced article that Dr. Jasmine presented to me before from the New York Times. And so I posted that one up as well. So it's good information. The one thing that I really would like to bring to this group, and especially the harm reduction partners out there, is that now is the time to do advocacy and education in a really big way. And so now is the time to reach out to all your legislators and really push this because we don't want this to get, like Lee said, muddled in this type of misinformation that has been, that sometimes, really starts defining how things get pushed. So that was really my intent with wanting to present today, is to really encourage a massive push to legislators and so forth to support the harm reduction services that are out there and to keep it going. There is no letter that's been prepared. Well, and as a state employee, I'm talking about education and so forth, but we have to be careful of the things we can and cannot do. But I really would, it's almost like a call to arms for this group and other groups like it to really reach out and really spread the word. Because again, as soon as I saw that bipartisan bill introduced, it really started demonstrating how quickly something can flip. So I did mention that SAMHSA had put out the grant. They also created a summit, a harm reduction summit that I was part of. And in that summit, there was a lot of conversation of setting up the definition and the principles and the values and the strategies that SAMHSA moved forward. That summit was based on the recovery summit from more than 20 plus 30 years ago. That really set the stage for SAMHSA to support recovery support services. And so it was really interesting that this summit and then the steering committee that came out of it, which I am also part of it, all was working, and we're currently working right when all this reaction to harm reduction, or what people are calling harm reduction, when this all came through. So I did want to inform you that Illinois is well represented as far as our at the federal level. Well, at least you're represented by me, so I'm assuming that we're well represented. But we are represented in the steering committee that SAMHSA has put together to help them basically define their platform moving forward. And so at this point, we're working through in work groups on doing that. But again, really, the point of this is let's do as much education and advocacy as possible to really nip this in the bud, because this is one of those things that happens where you go, this is just completely ridiculous and needs to be, people need to be educated. So if you have any other questions, I'll take them. That's it for me. Thank you, Lee.
Thank you, Raphael. Any questions for Raphael? You can use the hand raiser, or you can jump in, or you can put your information in the chat or your question in the chat. Well,
We just got a resounding bravo, Raphael. Everyone's saying thank you for all of your hard work, including Dr. Tanya Sorrell and others who's praising you. I'm not sure exactly what it is that Miranda shared. Someone was asking for a letter to our representatives that has been prepared that we can share. And I'm assuming that was posted in the chat box. Someone also posted the New York Times article about Biden and the crack pipe story that has been going viral all across the nation. Thank you so much, Raphael. No questions at this time that I am seeing. Oh, wait, Carolyn Bloom. Hi there, Carolyn. She says, any idea of how many orgs applied for the SAMHSA's funding?
I do not know. Anybody on this call, any of your organizations applied for the harm reduction dollars? I'd heard from some organizations that they were going to apply, and without opening this up to a full, long discussion, I think that I would really love, if you're interested in meeting with me and talking about how we as a task force can rally to support any organizations that are applying for some dollars. Pretty much right now, we just kind of float out, hey, somebody's going for this, and if you have any objections, please let us know. But if we'd like to create some kind of process for having our group or having our task force imprimatur on any applications, please, if you're interested, please let me know.
That long link that Miranda put there takes you to the we are the Drug Policy Alliance, and it is a form letter does it go to legislators, Miranda?
Sorry, I couldn't get my computer to unmute, but yeah, it's a letter that the Drug Policy Alliance prepared, and if you put in your address, it'll send it to your legislators. And I assume there'll be some groups coming out with some more opportunities to advocate and send out letters to legislators to oppose this.
Great, thank you.
Yes, I think that's fantastic, and I think this is a great vehicle to spread the word.
Great, great, great. You know, I do want to mention along the lines of harm reduction, Dr. Napier, Celeste Napier sent last week an information. There's a report called Commission on Combating Synthetic Opioid Trafficking. It was a final report. I'm going to put the link in there. It really, you know, one of the co-authors is Tom Cotton, Senator Cotton. So, you know, there's a lot of beating up on Mexico in it, but anyway, there's some good information, some recommendations on harm reduction that I think that you need to be aware of. I think it's on page 23 or so, but I'm going to plop that in the chat, and you can take a look at it, because we want to hold some folks accountable for their words and their response, you know, and their recommendations. So there's a lot of information about, you know, how to support harm reduction and a lot of stuff on interdiction that it's not really in our wheelhouse. But thank you, Dr. Napier, for sending that. Appreciate it. And thank you, Raphael, and thank you, everybody, on this. And we'll take that, look at that letter and circulate this. Look for you know, the recap of this going out tomorrow or by Friday. So you'll see the video and all the information that we've captured in the chat as well. So I don't know who from CDPH is going first, but please, whoever wants to step up.
I'll be very brief, and then I'll hand it over to Blair.
Okay, thank you.
To piggyback. Oh, hi, everyone. My name is Dr. Wilnish Jasmine. I work at CDPH as the Medical Director of Behavioral Health. I just want to piggyback off of what Raphael just talked about and share this additional link. The New York Times on Valentine's Day released an ad, that a full page ad on harm reduction led by Vital Strategies. And I just am sharing it today because I recognize at least two people from the Illinois area in here. So we have Erica Ernst from CRA. I see her picture, and James Kowalski used to work for Super, now he works for IDPH. So I don't know if there are any other Chicagoans or people from Illinois included here. So now I'll hand it over to Blair Akins. She will talk about go into more detail about the 2020 opioid brief we released at the end of December.
Hello, everyone. I'm just getting my screen together. Hold on. Okay, are you guys able to see my screen?
Yes.
Okay,
Yes, we are. Thank you.
thanks. And thanks, everyone. Like Walnice just said, my name is Blair Akins. I'm an epidemiologist with the Chicago Department of Public Health, working in substance use. So as Dr. Jasmine mentioned, we released an 2020 opioid brief through our HAN alert system at the end of last year. So I am just going to go through a few of the data points that are shared in there. And then I will also say, we also updated our Chicago Health Atlas to include 2020 opioid-related overdose death data and 2020 EMS opioid-related overdose EMS responses, if you would like to dive into the data deeper yourselves. So here, we're going to start with EMS responses. So we have opioid-related EMS responses citywide and specifically on the west side for 2020 and 2021. And as Lee has already mentioned, we did see a lower number in both the citywide totals and the West Side totals from 2020 to 2021. So on the right-hand side, we have the month by month EMS responses for 2020, which is in the darker blue, and 2021, which is in the lighter blue for West Side, which is including Austin, West Garfield Park, East Garfield Park, North Lawndale, and Humboldt Park. So in 2020, there was 5,917 opioid-related overdose EMS responses in the West Side, and in 2020, there was 4,040. And if we're looking on the right side of the chart for citywide, again, the 2020 numbers are in the dark blue and 2021 in the light blue. So we had about a 20% decrease. So a total in 2020, there was 13,794 responses. In 2021, about 11,100 responses. And so this is, compared 2020 to 2021 for EMS responses. Unfortunately, we don't have death data for 2021 yet. It takes a long time before all those cases are processed. So we're not able to say at this time if we will see that same decrease in opioid-related overdose deaths. From the preliminary data that we have seen, we know that it won't be that dramatic of an increase, and it's looking like it should be pretty stable, but we can't say that for sure yet. So now I'll go look at taking a deeper dive into the 2020 data. Sorry, I can't talk today. So in 2020, there was 1,302 opioid-related overdose deaths in Chicago. And so this chart shows the number of opioid-related overdose deaths in Chicago from 2015 to 2020. And so from just looking at 2019 to 2020, there was a 52% increase in the number of opioid-related overdose deaths. So here we have a map on our right side of the opioid overdose death rate among Chicago residents in 2020. And so the darker the shade indicates the higher the rate. And so you can see some of the highest rates of opioid overdose deaths is on the West Side. And so in 2020, 97% of Chicago community areas were home to at least one resident with a fatal opioid overdose. Are Austin with 97, Humboldt Park with 64, and North Lawndale with 49. Sorry, my computer is freezing and not wanting to. Okay. So in 2020, fentanyl was involved in 86% of all the opioid-related overdose deaths in Chicago. And so in this chart, it's kind of a lot going on, but the gray bars in the background represent the total number of count of all opioid-related overdose deaths for that year. The red solid line represents the number of deaths that involved fentanyl. The red dashed line represents the number of deaths that involved fentanyl without heroin. And then the blue line represents the number of deaths that involved heroin. And the blue dash line is heroin without fentanyl. And then greens is prescription opioid pain relievers. And so as we can see, for the last couple of years, this red line, which is fentanyl involved, has been increasing, as well as this red dash line, which is fentanyl without heroin, and the blue line of the heroin without fentanyl has been decreasing. So now we'll take a little bit of a deeper look at the different demographic information. So in 2020, opioid-related overdose deaths were the highest among males. And this is similar to what we have seen in many previous years. So the black line represents Chicago as a overall. So in Chicago overall, the opioid-related overdose death rate was 47.8 per 100,000 people. For males, that was 78.1 and 19.7 for females. And so now we'll look more specifically at race ethnicity. So in 2020, opioid-related overdose deaths were the highest among Black non-Latinx individuals, with a rate for Black individuals being 79.3 compared to just 35.3 for non-Hispanic white, non-Latinx white, and 29 for Latinx and 3.3 for non-Latinx Asian. And so here, just to kind of get a sense of what we have seen over time when it comes to race ethnicity breakdown in opioid-related overdose deaths. And so purple represents Black, non-Latinx. And so we can see that group has been consistently the highest over the last several years, which saw a really large increase from 2019 to 2020. Red represents non-Latinx whites. Blue represents Latinx, which also saw a pretty significant increase in rate between 2019 and 2020, and green represents non-Latinx Asian. So here we're looking, taking a closer look at age. So in 2020, opioid-related overdose death rates were the highest among 45 to 64-year-olds. And you can see with the rate of 108.9 per 100,000 population for 45 to 54-year-olds, and a rate of 132.4 for 55 to 64-year-olds. And then again, if we look at over time, opioid-related overdose death rates have increased the most among people aged 45 plus. And so really, if we're looking at this like lighter blue line, which represents 55 to 64-year-olds, we've seen that that's increased significantly over time and increased significantly from 2019 to 2020. And then if we're looking at this yellow line, which is 45 to 54-year-olds, which has also increased greatly over time and increased greatly from 2019 to 2020. Yes. And that is it. So I am happy to take any questions. Again, all the data presented here can be found on the Chicago Health Atlas or was in our opioid brief.
Nice data, great presentation, Blair. I was wondering if you or anyone else had any thoughts as to the reason that the opioid, the overdoses are so much higher amongst 45 to 65-year-olds.
Yeah, that's a really good question. And anyone from CDPH, feel free to jump in at any time. And something that we've definitely been thinking a lot about. I don't know if we necessarily know the reason for that. I mean, thoughts that I've had possibly, is people in those age group probably have been users for a long time. I don't think probably most of them didn't just begin to use. And with the composition of the drug, the drugs changing in Chicago, I've wondered if maybe like fentanyl being more likely to be in the drugs for someone that's been using for a long time, if their bodies are not able to handle that, as well as people become older adults, they tend to have more chronic conditions and the effects that can play hand in hand with drug use.
Hello, this is Ed Boone. I think we might be able to find some answers to that by looking at the environments, the living situations of these individuals that have overdosed. Were they unemployed? Were they employed? Were they living in homeless shelters? What's their living situations? I mean, taking in all of those dynamics and just comparing and see, are there any similarities across those age groups? I think would be helpful.
Yeah, thanks, Ed. I think that's a really great thing that you bring up. In our data specifically, we don't have necessarily that background information for each person. I know that that's data that you probably have in the suitors data set that we would love to work with a little bit more to answer.
Yes, that is some data that we can gather from our coroner's reports so that it's useful and available. And we would be glad to make that available to you guys.
That sounds awesome. We can
Fantastic.
connect with you offline about that.
Thank you, Ed.
Hey,
And
Lee,
thank you,
I
Blair.
just,
Sure, Carlos.
yeah, I just posted in the chat. I think one that would be worth looking at, Dr. Lindsay Richardson from the University of British Columbia is going to be presenting next week, Thursday, 3:30 to 5 o'clock our time, about this linking like economic lives of people who have drug issues with policy and well-being. I went to one of the roundtables, Lee, that you had invited us to, and they have really good information just to just give us a broader picture to be able to kind of figure this stuff out.
Fantastic. I do want to mention, go ahead.
Mr. Lee, this is Maretta Brown Miller. Good afternoon, everyone.
Good afternoon.
My question is, Ms. Blair, is that I know that you cited the statistics on the overdose on the west side in those communities, but are those measurements, like are those measurements taken from people that just overdose here? Do they consider that these people are white, non-Latinx that come over to our community, to the East and West Garfield, Austin community to purchase drugs and might overdose on this side of town? How is that overdose counted?
That's a really great question. So for this data that was specifically to the west side, that was EMS responses. So that data was based on the location that the EMS response occurred. So you're correct. That does not mean that just because someone overdosed at a specific location, that's the same location that they lived. So that was counting incident location. The death data that I shared as well was also based off of incident location. The one map was based off Chicago residents. So that data was all people that had an opioid overdose death, that the death occurred in Chicago. It doesn't necessarily mean all of them are Chicago residents, but their death occurred in Chicago. On our Chicago Health Atlas, we do have the data broken down by incident location, so where it occurred, and residence location. So that would be looking at specifically Chicago residents.
Thank you.
I'll post a link in the chat to the Health Atlas.
So I'm the timekeeper, and I want to make sure we get everybody a chance to get in. This is great information. I do want to mention, and Dr. Jasmine and Blair, you could help me out here. CDPH has been hosting meetings of Westside SUD providers every month, where you share the heat maps, et cetera. I know the next one I think is going to be on the 28th 25th at 10 a.m. If you're interested in this, should they reach out to you, Dr. Jasmine, and so that they can get information about the meeting?
Yes, I'll put my email address in the chat.
It's great, because we do have heat maps where overdoses are occurring that show month to month increases or decreases, and also year over year. And we're kind of haunted by the 2020 increase over 2019. And I think that one of the things we want to pull out of this is that there were almost 2,000 less EMS calls for overdoses on the west side in 2021. A lot of the times the press will lead with the 2020 information, but I think there's some room for hope. We hope that this trend continues. And also that, when we find out about the deaths, that we're seeing a decrease in that as well. But that means just more, we got to, keep up the fight, keep up the struggle, and keep being out there on the street. And to that, I want to transition over to Lou Sias, just give us an update on the task force outreach team that the Prevention Partnership puts out there, along with our partners in the treatment field. Lou, do you have some update on some of those numbers?
Yeah, Lee, thank you. And I bring you greetings from the West Side Task Force team, the street beat team, I call them, and also the collaborative groups that we have, about 8 organizations that periodically come out with us, and they provide warm handoffs for the various programs and resources they have. But in the month of January, even in the inclement weather, we've trained over 137 people directly in the streets, and virtually we did over 34 people. So I think that was pretty good due to the weather in January. And look like the numbers are going to be even larger in February because we're gaining momentum as the weather changes. And I still would like to invite those of you out that never been out with the team, send a representative, stop out, see what we're doing, and do a debrief with us. If you have suggestions, input, we would appreciate it. And again, greetings from the outreach team.
Fantastic. No,
Excuse me, Lee.
Yeah.
Lee, this is Alderman Walter Burnett.
Yes,
How you
hi.
doing? Hey, excuse the work, the noise in the background. They're doing work in my building. First of all, I want to commend LaShawn Ford for all the work he's doing with this effort, and commend all of the organizations. Thank you all very much for everything that you do and all the collaboration that you all are trying to do with helping people not to OD, and also trying to help them get off of drugs. Luther, and I appreciate your team. And, you know, I was just telling my staff, I had a staff meeting every Monday. I was telling my staff, I drove up on a group of guys just sitting around waiting for drugs. You know, I went on the corner, they weren't drug dealers, they were drug users just sitting there waiting for something. I guess it was a free pass out or something getting ready to happen, you know? And they were just standing there, and it just really, and you know, they're regular folks, somebody's family member, and it just hurt my heart that they just sitting there. And I thought, you know, folks should be passing them out information of how to get help if they wanted to get help, right? You know, we always talk about those folks, but we don't ever encourage them to do change. And I was telling them I got a brother who, after 25 years, I've been talking to him every day. He finally heard me and got off of alcohol, right? So I know you all do what you do, Luther. I think it'd be good if some of our public facilities, if we could have some information to direct folks to get help, not only to if they OD, but also before they OD. Right? If we can direct them to where they can, if they want to get off of drugs, where they can go, you know, the libraries, the alderman's offices, the state reps offices, the congressman offices, if we can have things where we can get people help. Because, you know, like right now, I'm giving out masks, right? Where everybody from every walk of life is coming in to get masks. Some people are addicted to drugs, some people aren't. You know, and they looking at the tables, and we get a lot of folks with mental illnesses. They feel comfortable coming to our offices, right? And if they can see these pamphlets on the table, maybe they'll grab one and read it, right? And,
Correct.
And go to one of those facilities. So if there's anything we can do, you know, or work with you all to do these kind of things, I love to help. You know, I always tell the guys who helped me on the campaigns, we got to be like Jehovah's Witnesses, right? We got to bug people until they start hiding from us, right? And don't want us to come to the house, you know. But no offense to any of you all if you're a Jehovah's Witness, but but you know,
well,
but if there's anything we can do, you know, please let us know. If you got any pamphlets and information where we can direct people to go and get some help if they need it, I love to have those to be able to share with folks.
Alderman, even better than that, you know, I appreciate the information, and we would like for you, if you get our scheduler information, that would be great. But we would be willing to train people in your office, in your ward office, your block clubs, your churches. We don't just do street training. I'm sorry. We also train groups, and we do it virtual or in person. A lot of the groups prefer the in person because our trainers are people from the community with lived experience, know the community, and the engagement go over much better. But if you see groups that are congregated that you think need training, please get the information to me, or we will be contacting you to see if you have any idea locations, a group, and please get us in groups, and we can block clubs. We can go right out and do that on a daily basis. I appreciate it. I'm glad you asked about that. Thank you.
Yeah, so Luther, if you can call my office, maybe you can set up with my scheduler. Her name is Mary Ann. Maybe we can sit down and talk and strategize on how we can help with this situation. Like I would have loved to have been able to go in that corner and just gave those guys something. You know what I'm saying?
Right.
It was about 15 of them, man, just standing there. You know, I thought they were drug dealers, but they weren't drug dealers. They were drug users. You know.
Well,
and,
great.
I love to help. Okay.
I will. If the number you would like me to contact, if you could leave that in the chat, I would appreciate it. And use it. Any of our information, you'll see my number on it. And that number is good from 7 in the morning to 11 at night.
All right. God bless you all. Thank you for everything you all are doing to help people.
Appreciate it.
Wonderful. Thank you so much. I want to be cognizant of time and get some questions over that are asked in the chat. Someone is saying, does anyone have resources in Lawrenceville, Illinois for treatment options? If so, there's an email there for Michelle at PCC Community Wellness. You all can communicate directly with one another, leaving your information and numbers in the chat box. Lee, we are right at 1:47, a little under 10 minutes to go. So I wanted to turn it over to you. Make sure you didn't need anything or have anything else to present out.
Okay, well, thank you, everybody. Thank you, Alderman Burnett, and it's great to have you here. And I just want to reiterate, we're finding that a lot of organizations, even in the field, haven't trained all their staff in how to recognize and respond to Narcan. I know TASC was one of the early adopters of getting top to bottom, bottom to top training for their whole staff. You know, what getting Narcan out and getting trained to everybody's got skin in the game. They all become harm reduction specialists, or at least harm reduction part of the core when they get trained, and it changes everybody's perception, I think, when they realize that they can save a life. But I do, again, in the interest of time, I want to move over to Matt Ashley from the Way Back In to present. We probably got about 5 minutes per presentation. So welcome, Matt.
Welcome, Matt. I think you're still muted. All right, there you are. All righty, he's got it. Awesome.
Gotcha. Unmuted.
We're seeing that you're attempting to share your screen, but not hearing you. All right, there you go.
You got me?
Yep.
All right. Can you see the screen?
Yep.
All right, great. Yes, my name is Matt Ashley. I'm the Oxford Outreach Coordinator for the Way Back In. I work for the Way Back In. I've been working a little bit with the Oxford House, Inc. Some time ago, we did get a grant from the state of Illinois that allows us to open up Oxford houses around the Chicagoland area, targeting individuals with history of opiate use. We do have one house open in Melrose Park at the moment that occupies 6. We've actually we've had the same individuals in our house since April of 21. So it's actually been quite successful with that. We are in the process of looking for more houses. We're having a tiny bit of trouble with that. It's been a little nutty, but we just keep on pushing. We do kind of recommend a little bit of outpatient before they come into one of our Oxford houses. It is not it's not necessary, but we feel that it would be a little bit better if they had some detox or 20-day program before coming into one of our Oxford houses. We are Suboxone and Methadone friendly. So that kind of helps out, being that it is targeted toward people with a history of opiate use. So we are MET supported for sure. Our Oxford houses are democratically run and self-supported. All of our residents are working. Some of them going to school. We actually just had one of our gentlemen just graduated college, which is awesome. WBI pretty much acts as kind of like we oversee the houses. So we are looking for houses to rent, and we kind of deal with the landlords and stuff like that. So it's important that we're there to kind of oversee, just in case anyone unfortunately relapses or anything like that, that the landlords don't have to deal with it. That's our responsibility. Yeah, Oxford House model has 3,200 self-sustaining sober houses utilizing Oxford House model. More than 25,000 individuals in recovery living in the houses at any one time during a year. Over 46,000 living in an Oxford House during the course of a year. So the Oxford House website is actually at the bottom if you're more interested in what they do. And all my information is actually in the chat. So feel free to hit me up if you have any questions or anything like that. And we are looking for single family homes to rent and for more investors to work with. So if anyone knows anything that might be able to help us out, please hit me up. But I believe that is all I have.
Thank you. That's a pretty slick presentation process. I know.
Thanks, Matt.
Mark that down. Thanks so much. You know, I went out and had a nice chat out there with Anita and Phil last week. I used to live really close by over there in Maywood, and they said about 80% of their clients or their residents come from Chicago's West Side. So that was something that they really thought would be timely for them to be able to present. Were there any questions for Matt? Okay. And we're going to move over to Allison Anderson from Transforming Lives Catholic Charities. Allison, I gave you a co-host if you have any visuals.
Thanks, Lee. I'm going to share my screen. Sweet. So I'm Allison Anderson, and I'm a doula and a peer recovery specialist at Catholic Charities. On the call also today with me is Rachel Walton, and she's our case manager. We also have an LCPC and then another doula named Tanya. So our program is SOAR funded, and we work with women who are pregnant and parenting, postpartum up through 12 months. And we do doula home visiting services and recovery support. We use Seeking Safety and then Mothers and Babies when we do our home visiting curriculum. And we can take anyone during their pregnancy and then up until their child turns 1. We do MAR coordination, childbirth ed, postpartum care, breastfeeding support, transportation. So we have the ability to order Ubers for our people to get to appointments, to get to MAR, and for anything related to the parent-child dyad. We do monthly groups, and then we also have case management, and we also provide parenting essentials like diapers, wipes, car seats, strollers, all that kind of stuff for our active participants, basically just trying to set them up for anything that they could potentially need for their parenting journey. So in case you don't know what a doula is, doulas are trained to provide emotional, informational, and physical support. We stay with the participant from any point in their pregnancy through prenatal care up through labor, delivery, and then immediately postpartum. And our job during the process of birth is to give evidence-based information and help with the medical decision-making process, and also support their bodily autonomy. Having a doula present during labor has been associated with shorter labors, quicker cervical dilation, and higher APGAR scores for babies. Also, babies born where a doula is present during the prenatal care are 4 times less likely to deliver with a low birth weight. and 2 times less likely to experience a birth complication. So our jobs are really to do some advocacy and provide non-judgmental support for our participants. We use an acronym called BRAIN to help them learn how to make decision-making during the process of their medical care. And then because the risk for overdose increases around 7 months, our program is designed to stay with moms up to 12 months, really working on reducing the risk of overdose, because around 7 months, sometimes people stop breastfeeding or their children become more mobile as they learn to crawl or walk. And I'm going to make sure that we're catching that population. And all around, birth is kind of like a very transformative experience for most people. So we want to capitalize on that by making sure that they feel really empowered and that their goals are honored. Obviously, we understand trauma is a big part of why people can sometimes use drugs. And so our goal is to be very trauma informed in our approach. We focus on creating safe space for the pregnant person, which includes safety planning, naloxone distribution, and setting healthy boundaries. And again, we really work to communicate their needs with them and help them actualize their goal of a healthy and positive birth experience. I'm going to end with one of my favorite quotes, which is that everyone wants to hold the baby, but who will hold the mother? And I think that encapsulates what our program does really well. We hold the pregnant and parenting people so that they can then hold their baby and hold their family. And I'm going to pass it over to Rachel really quickly to just talk about how you can refer people to us if you have pregnant or postpartum people.
Hello, everyone. Yes, I'm Rachel Walton. I'm the case manager for the program. So if you have anyone that you feel can benefit from any of our services, please feel free to email me or call me. That's my direct email and my direct line. At any time, we will return your call within 24 hours or respond to your email within 24 hours. And this is our flyer. My information is also on that as well. And thank you guys for taking the time out to listen to us while we present it. We really appreciate it.
Well, thank you.
I'll send this flyer to you so that you can.
Yes, yeah. We'll send, if you'd like, you can send the whole presentation and we'll put it out with our recap. That goes to you, Matt, as well, and anybody else who had a presentation. And we'll get the chat out and a recording. That's awesome. I really appreciate it. And Allison spent a lot of time trying to make sure she got our emails. I think we finally figured out how to get it done. And thank you so much. And if you're not getting emails from the task force, again, please put your information. We'll hold the meeting open, the Zoom open for a few minutes. I was hoping Vonna might be on because she and Rep. Ford made a presentation to the National Association of Recovery Residents last week. And they were completely amazed by how Chicago and how the Illinois has been pulling together around harm reduction and all that work, and pretty much got a lot of interest from people about overdose prevention sites, even from groups that are primarily abstinence based. So, you know, I'm rethinking the hour long because sometimes we've got a lot of great information and 60 some people here that probably have great ideas and things they want to share, but be looking for the recap. I'll hold the meeting, the room open for a while if you'd like to stay and capture any of the information in the chat, or if you have any particular questions that are lingering. Any other hand raises before we leave?
Just a lot of praise to Allie and Rachel for such important work. We thank you all for your services. That's really important work.
Thank you, everybody.
I am saving the chat, so you'll get a copy of that, as Lee mentioned, and this video recording and any other presentations that were shared today. Thank you, everyone.
All right.
I think Dr. Sorrell has her hands up. Hey, Dr. Sorrell.
Hey there, V. Thank you so much. Just a quick question and kind of asking regarding approval from this from you guys and the team. I had mentioned and spoken to Lee earlier a couple of weeks ago that Rush is looking at and following the steps of the need for harm reduction and recovery, putting in an NIH program grant application to develop our Chicagoland area sites, including the West Side and the South Side, regarding recovery support clinical research. We all know that recovery support helps. Scientists, the medical community knows something works when there's research behind that says it's evidence-based. We know in our everyday practice that recovery and harm reduction saves lives. They're also looking for that evidence-based research to say this is a science regarding that recovery. So Rush will be putting in an application, and we'd like to include the West Side Task Force as that grassroots center to look at building recovery support research ideas and topics. But anytime we want to do something that's community-based and community engaged, I always, as part of academia, want to make sure that it's something that the community would want and want us to move forward to. So as Lee and I talked about this proposal, he also said, let's ask the group if you guys would feel comfortable for our including of the West Side Task Force as one of the groups to develop the partnership for a research recovery network.
All right.
Any ideas, thoughts, or questions? The topics and activities that would be, and that would be about a $2.5 million grant over the next 5 years, would be building a coalition of recovery support workers, community engaged workers, to start the process of helping people recognize that when we hear the issues and concerns for the community, we can turn that into an actual scientific research study, and then have participants feel comfortable participating in a study when they have a say in what we're studying and it makes sense to them. And so that the information and research and results that we obtain come directly from the community and benefit directly to the community. And so we'll be looking at developing that network of partnerships as part of the academia with Rush and the University of Chicago, and then reaching to the South Side Task Force and the West Side Task Force. So some meetings, get-togethers, discussing of what topics we should be researching in recovery. Those would be the activities that would then be covered and funded then from this grant.
Okay. So what do you need from us by when?
We'll be putting it through our research review on February 28th, and I would just need a letter saying that the West Side Heroin Opioid Task Force has a letter of support for this project and would work with Rush as a partner for this grant.
Nice. Okay.
Okay.
Please send me any information, everybody at West Side Task Force at yahoo.com if you have any objections. Otherwise, we'll send you a letter.
Yeah, I'll work on that with you, Lee. Thank you so much, Dr. Sorrell. That's perfect.
And this would allow the exact same things that we were talking about. One of our projects as part of the Leadership Center is to start having Narcan distribution and substance use education at laundromats in local areas, at beauty shops and barber shops. We're waiting for our IRB to be approved for us to start that evaluation program. So just as the alderman and many of you also said, we're going to meet people where they're at. And we're so happy to be working with Lou and getting his advice and guidance and helping to develop that. Ken Tribula, who's on our call, the outreach manager, if you know of a laundromat in your area or region, a beauty or barber place that you go to, then and please send that information to Ken, who's put his email in the chat, and he can contact the manager of the laundromat or the area or the beauty shop to discuss adding and starting a calendar of when we can have these types of community engagement activities with Ken and Singrid, who's our outreach recovery specialist. She also is an expert at finding referrals to agencies. So I know, Michelle, you were looking for services. I'm sure she's already gotten in contact with you about finding placements for clients. She's found placements for folks all the way down to Springfield. So the RLC is happy to be helping in all of those ways. Thanks.
Well, thank you. And thank you, everybody. And bring extra clothes when you go out today, because when you come back, you're going to need them. All right. And thank you,
Great.
Dr. Sorrell, for all the great stuff you do. And we'll see you all around the bend. Thank you so much. We'll leave it open in case you need to grab anything off the chat. See you, Julie. Thank you, Father Tom. Always good to see you. Andre, keep doing it, man.
Have a
Bye,
great
Singrid.
afternoon, everyone. Bye-bye,
See
Lee.
you. Thank you. See you, Dr. Nance. Everybody, Peter Gubby.
Thanks, Lee.
Hey, thank you. See you. Appreciate it, Allison. Good to connect with you.
See you later, Lee. This is
All right.
Willie Davis from Lee.
Willie, thanks a lot, man. Listen, my condolences, my friend.
All right.
Please stay connected.
I will. And I'll send your email because I'm going to copy that letter as well.
Okay, sounds great.
All right. Have a nice evening.
Okay, appreciate it. Hey, thanks, Taylor.
All right, we're dwindling down. I don't think anybody needed anything here.
Yeah, Tanya came back. Hi, Tanya.
Hey, she probably just wanted to reiterate what we needed for that. Thanks for that, Dr. Sorrell.
Hey
So
there, I'm
let's-
sorry, and I went to click to hit the save the chat and it clicked me out. And so now all the chat's gone, isn't it?
Oh, I have the chat. No worries.
It'll come with our recording.
We'll
It'll
get
come
it.
with our
We'll get it to
recording.
you.
Okay.
So
We'll get that to you. We've got an email that'll go out before end of the week. We have someone else, Salmar, still on the
Ms.
line.
Martinez, did you have something you wanted to share or chime in?
And you're still recording too, but I'll wait for the recording information in chat. Thanks so much.
Yeah, we'll get it. We can probably get it out to you sooner than send the rest of the group if you'd like.
Okay, no worries. Thank you.
Okay,
Have a
good to see
day.
you. Thank you. All right, V, we'll see you.
All right, all good. You need something
Thanks so
else?
much. Good meeting, huh?
Very good meeting. Every time we're an hour, it's not enough.
I know, but I mean,
It
we
is
just,
what it is.
yeah, it is what it is. So,
No worries. Let me know if you
Great.
need anything else today. I'll be around.
okay, thanks a
All
lot.
right. You're
Bye.
welcome. Bye.